Hi, my name is Niamh Daly. I am a consultant obstetrician and gynaecologist at the Rotunda Hospital in Dublin. So PCOS is a common condition in which hormone imbalance causes irregular periods, increased hair and acne, and it may affect your fertility. And it can also affect your long-term health as well. About 2 to 26% of women can have PCOS, but it depends on where those studies are done and the population studied. And the cause of PCOS isn't really known, but it might run in your family. So you might have a mum or a sister that had PCOS before or who had irregular periods. And the symptoms of PCOS are related to a hormone imbalance, specifically too much testosterone and insulin resistance. PCOS is diagnosed when you have any two of the following: irregular, infrequent periods or no periods at all, an increase in facial or body hair, or blood tests that show an elevated testosterone level, or an ultrasound that shows polycystic ovaries. So if you have two of those three features, then you're diagnosed with polycystic ovarian syndrome. The first long-term health risk with PCOS is insulin resistance and diabetes. So women who have PCOS have an increased risk of developing type 2 diabetes later in life, or indeed in having diabetes at the time of their diagnosis of PCOS, depending on a number of factors. If you have PCOS, you also have an increased risk of having pregnancy diabetes or gestational diabetes, and if you have PCOS, you should be screened for this between 24 and 28 weeks. If you have PCOS, your risk of developing diabetes is increased if you're over the age of 40, if you have relatives with diabetes or a family history with diabetes, and if you are overweight or obese. These all also increase your risk of developing diabetes. The second risk of PCOS long-term for your health is high blood pressure and cardiac health. And these are related to your insulin resistance and probably your vascular health or the health of your blood vessels. And these are probably more impacted by your weight and diabetes risk than by PCOS directly. The next big risk of PCOS for your long-term health is, as I mentioned a little bit earlier, endometrial cancer. Women who don't have a regular withdrawal bleed are at risk of having abnormal cells slowly form in the lining of the womb. And this, over periods of time, long periods of time, can develop into endometrial cancer. So part of our treatment priorities, or one of the cornerstones of the management of PCOS, is to try and make sure that women have at least 4 periods per year to try and prevent that risk from developing. There are several ways to protect the lining of the womb. If you attend a healthcare professional with symptoms of PCOS and you're worried about the long-term effects, your healthcare professional should discuss with you treatment with a hormone called progesterone, and this can come in many different forms. One of them is a non-contraceptive that you would take for maybe 5 days in the month, and it would induce a bleed regularly for you to ensure that you have at least those 4 periods per year. And other forms, depending on other factors in your health and your own personal desires. For example, if you didn't want to have a pregnancy, might be the contraceptive pill, either with estrogen or without. It might be the progesterone only pill. And then for women who are desiring a little more long-term contraception or long-term protection, a coil coated in progestogen hormone can reduce the risk of development of abnormalities in the lining of the womb. Lastly, PCOS is associated with depression, mental health issues in women who suffer from PCOS, and it's not really known how this happens, but part of it is probably a loss of self-esteem in body image in women who have hirsutism or hair in unwanted places, acne, and difficulty in losing weight. And part of it may be hormonal in that it may affect your mood, just the hormonal imbalance in itself, even if you don't have any of those symptoms. So it's really important that if you have a combination of those symptoms, that you attend your GP for the best possible care. Yes, there are treatments available. And these treatments depend on your age, your own situation, your desire for a pregnancy or your desire for contraception. And you should be involved in the decision making for your own treatment. So if you have PCOS, you need to make sure that you explore all the options of treatment with your healthcare provider. Treatment usually starts with healthcare and lifestyle advice. So obviously anyone who struggles with weight or has struggled with weight loss or weight gain, it's really important that you focus on eating healthy food, a balanced diet, including fruit and vegetables, unprocessed food, and that you exercise. I think the national guideline recommends that you exercise 30 minutes 5 times a week. So I think that's something that everyone should be focusing on, not just women with PCOS. And then there's a number of hormonal treatments. For example, another priority for treatment would be to induce regular periods. And some people worry that they may have difficulty conceiving, but they don't quite want to get pregnant yet. So it's really important that women who don't want to get pregnant yet are provided with appropriate contraception for them. And then there are a number of hormonal treatments aside from the progesterone for withdrawal bleeds. So we sometimes prescribe something called inositol. It's a new food supplement which has been shown in small enough studies to reduce insulin resistance, to increase the frequency of periods, and to reduce the risk of miscarriage in women with PCOS. And then the next step would be metformin, which is actually a drug that we use in the treatment of diabetes. And when we give metformin, again, because it's an insulin resistance problem, PCOS, the metformin can correct that and periods can become more regular, and the symptoms of PCOS can sometimes reduce or disappear with metformin. And in particular, it has helped women with PCOS to become pregnant. I think it's really important as healthcare providers to put ourselves in women's shoes. I often think when women come to the clinic with symptoms of PCOS, such as unwanted body hair, acne, difficulty losing weight, concerns regarding their fertility, that it must have taken quite a journey to get to see us, and that it takes courage to attend a GP and to attend a gynecologist with these problems. And it's really important to respect that. And I think it's really important for us to educate the general public on the symptoms of PCOS, so that if, for example, you see a woman with hair on her face or who is heavy, just to consider before judgment that there may be other things going on in that woman's life that may be causing her weight gain or her difficulty in hair or acne, for example, a hormone imbalance, and that she may be seeking medical advice. And it's really important for us to have that empathy for women.